come into my office today, and my orders are to give Charles Camaro an injection of Hep B. So I'm going to get his AR, and I notice that I'm going to do my first 6 rights. I'm going to have first medication is Hep B. I've got the right patient. I've got the right dose of 0.5 mLs. He's going to get it intramuscularly. He's going to be getting it for prevention of hepatitis B.
And I'm giving
the right date. So today he's going to be getting it. It's the first of 3 series. So he's going to need to come in 2 more times to finish off the series. And he's going to be getting it this morning. Right now it's noon, so this afternoon. So I'm going to come over to my cart. I'm going to wash my hands. I'm going to gather my supplies. So for this,
and I'll pull the sheet for safety.
I'm going to need my plate to carry all of my supplies in. I'm going to need
I'll do my lab check before I put the medication
alcohol prep pad.
So this is
going to need
a
syringe. It is going to be a 1 ml syringe, 25 gauge, 5/8.
Right medication.
Yeah, I'm also going to bring the hand wash with me.
Right route to be given IM.
At that point, I'm going to unlock my med cart.
For inspection.
So I'm going to look inside the med cart for my Hep B vaccine.
Now I have all my supply, my medications.
My first check before I pull it out is going to be seeing my Hep B vaccine. I'm going to take out my Hep B, and I'm going to see that I need 0.5 mLs. 0.5 mLs.
So I'll come in, knock knock. I'll do my wipe.
Check the expiration date.
And I will introduce myself.
It's going to be for Charles Camaro.
So my name is George.
It's going to be intramuscular.
For
the reason of preventing
hepatitis.
I'm also going to write down the lot number and the expiration date, and then I'm going to also
I'll put on my
write down the manufacturer. So at that point,
and first of all,
I'm going to open up my medication.
So
to clean off the top of it,
0101,
top of the vial with a alcohol wipe. Let it air dry.
So this is the right patient.
And we're going to need 0.5 mLs.
So I will.
So I'll open up my syringe.
For giving this injection, it's given the IM.
Safely take off the
so I use my
top barrier.
Hand, and I will put
withdraw
my heel of the palm
0.5 of air.
My thumb will be facing the ground.
And inject 0.5 of air into the vial.
Will be facing the superior anterior
I'll then withdraw the medication.
And my other 3 fingers will be facing the iliac crest. And in between the V will be the crucial medius, the muscle I'm going to use.
Get rid of any air bubbles.
Do you think you have a need
I have
for a
my
cold
alcohol wipe.
compress or a warm compress to the area?
You're off. You're supposed to be down here.
If at any point in time it starts to
Then
get
put the sheath
uncomfortable,
back over
if
the
you would prefer
injection.
to have that on there, please let me know and I'll be happy to bring that.
The way it looks.
So inside of the sheath here is sterile, so the needle is still going to be sterile for my safety measures. So I did my math for 0.5 mLs, got my medication, and before I put the vial back into the drawer here, I'm just going to make my 3rd check of Hep B 0.5 mLs, Hep B 0.5 mLs, check the expiration date. Expiration date is 2020. Make sure that the patient of Charles Camaro, this is for Charles Camaro, going to give it today at noon. Today at noon. This is his first of first of 3 series, and he's getting it to prevent hepatitis. So I'm going to put the medication back into the drawer, lock the drawer, and then take my supplies over to my patient.
Before I leave the room, I'm just gonna do my documentation of the medication. I also need to document the lot number and the expiration from the medication bottle.
Yeah.
Where you have the medication.
Yeah, and you'll see where it starts and stops, so.
Knock knock.
So
Hi, my name is Justin. I'm a
identify
student
my
nurse
radmark,
at
the
HCC.
British media,
Is this Charles? I would ask
and
that to
I'll use
the
my alcohol
patient's
wipe.
mother. This is Charles Camaro. She says yes.
I'll
I'm going
clean
to do
up,
my second identifier. I'm
then
going
I'll
to
wait
look
for
at the
it to
armband.
dry,
This is in fact Charles Camaro. I'm going to look
and
at
I'll
the date
retract
of
the
birth.
shade,
11XXX as mother, 11XXX.
and
Okay, so today I'm going to be
it's
giving
intramuscular,
Charles
so
a
I'm going
B
90 degrees,
vaccine. This
all
is
the
the
way
first
down.
of 3 series, so he's going to have to come
and I'm
back in. And the
aspirating
reason why
it
he's going to be getting
to
this
make sure
is
that I'm
to
not in the
prevent,
veins, which is good.
Hep B
Then I'll
from
give the needle.
entering his system, give him a little bit of immunity. So I'm going to wash my hands.
Okay, okay, that's fine.
While I'm washing my hands, I can tell the mother to
Okay, good.
notify us if there's
I have my
any
alcohol wipe,
signs of disturbance,
and I'll
if
hold
there's any
there for
redness, swelling,
have a
any
minute,
signs
put some
of
pressure, make sure that my
infection,
patient is not breathing,
if the patient is
and
in
I'll retract
pain,
the needle
and just to let us
for
know.
safety.
So at this point, I'm going
I'll put it back to
to
the
raise the
supply.
bed up. I'm going to
So this is
get it
good.
into a position that's comfortable for me and for the mother and the patient.
So there's no breathing noticed.
I'm going to put on my gloves.
So I'll make sure my patient is comfortable. And I'll remove my gloves.
And this medication is going to be IM. It's going to be
And I'll
in the
observe for
vastus
the
lateralis
response.
of
So
the
the reason
right
we are
leg.
giving this medication
So to do this, I'm
is
going
for
to
infection.
end
The
up
patient will be
anchoring,
medicated for
the
6
knee
months,
down,
every
pinching
week,
the
the
thigh,
same time.
and injecting the medication.
So I'll make sure that the bed is up, the patient is comfortable, no problem, he is safe, the sidewalls are up, and
So
then
I'm going to clean
I'll
the
do
site
my
with an alcohol
documentation.
wipe.
Thank you.
I'm going to let the wipe, the alcohol dry. And then at this point, I would end up, for the sake of this exercise, I'm going to use this as my injection site.
So then I'll dispose my needle to the sharp container for safety. Thank you.
So this needle is going to be injected at a 90-degree angle with the bevel up. So I'm going to anchor down with my palm, squeeze or pinch the thigh with my fingers, and 1, 2, 3. Because it's a vaccine, we're not going to aspirate. I'm going to hold with my non-dominant hand.
The gauze would be between my
Inject
third and
the
fourth fingers,
medication.
ready to place onto the vastus lateralis.
Going to put the sheath back on. Take the gauze, apply pressure. while I'm applying pressure, I can again tell the mother to watch for signs of infection, any redness, any swelling. If the patient is in any discomfort, to let us know. So I can leave the gauze on here for right now. At that point, I can take my syringe and I would be able to put it into my sharps container, which, if I had one, it would be right here. So I'd put my syringe into the sharps container. I would then tell the patient's mother that I will be back to check on the response of the child.
And offer a cold or warm compress.
And at that point, I can lower the bed back down, raise the bed rail up, give them a call bell, complete for safety. I would exit the room, come back over to my desk, and then I would document that I gave the injection. Then I can take off my gloves, wash my hands, check on my patient, check for the response, check for any inflammation, any of the signs and symptoms of infection, and then I would also document that.